Welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your Week 8 video. This week is about ethics. The ethics in long-term care often involve the right to die, the right to refuse treatment, the right to make those end-of-life decisions. We're going to talk about advance directives, power of attorney, and guardianship. Really, in long-term care, autonomy comes up as the biggest ethical issue over and over. And a lot of that is because long-term care patients have lost some autonomy. They're often treated as dependent. And probably because they've lost some of that physical independence, so they need to be in a nursing home or a residential care or get care at home, that people equate that with a loss of decision-making. But that's really not the case. The system should always move towards creating as much independence as possible for people in the long-term care system. So, end-of-life rights come up often in long-term care, and these are often thorny ethical issues. These are the pillars of what we know. Patients can make their own health decisions. Even if you're in the long-term care system and you're 98 years old, you can still make your own health decisions. Patients have the right to refuse treatment, and that includes life-saving treatment. Now, some states allow the hastening of death through certain procedures. We're not going to go through that in this course. There is no current federally recognized right to die. However, there is a right to refuse life-saving treatment. So let's go through the various forms that the long-term care system uses to kind of help with these ethically cloudy, difficult situations of end of life. So probably the most popular and widely used form is the DNR, which stands for Do Not Resuscitate. A DNR is a basic document that's put in a medical chart that declares that no extraordinary measures should be taken if the patient's heart stops or they stop breathing. Often patients who are in the long-term care system, either in a nursing home or a residential care or getting home care, sign these as part of the initial package to get started in long-term care services. It's a fairly basic document and usually can just be done with the patient and their doctor. Now, an advance directive is a more complex document. And when I say advance directive, I'm talking about a whole host of paperwork. Many different states have many different advance directive forms. Now, there's no national advance directive form, and there's no federal law that talks about how you would do an advance directive. So what an advance directive looks like in Maine may be very different from what an advance directive looks like in Hawaii. An advance directive is a document where an individual gives direction concerning future medical care decisions. So for me, I might say, if I'm in a coma for more than 30 days, this is what I would like to happen. It's more complex than a DNR. And it's made for the case where a patient, such as me, can't participate in a decision later on. This document is often signed and witnessed and can be very limited in scope or pretty wide in scope. Now, a term that people use all the time is a power of attorney. Some people will say that a power of attorney is just one type of advance directive. I wouldn't necessarily argue with that, but it is much more specific. Power of attorneys, like advance directives, exist in every state. However, each state can define them differently. So generally, for a power of attorney for healthcare, you're going to have a signed, witnessed document, often drafted by an attorney. Some states do have a form that they provide to all citizens. And basically, this is where someone chooses another person to make medical decisions for him or her when they are unable to participate in medical treatment decisions. So I think, unlike an advance directive, a power of attorney is very different because rather than saying this is what I want to happen, it says I want this person to make these decisions. So it is quite different. Surrogates is a harder type of law to comprehend. Surrogacy laws, again, are different from state to state. There is no federal surrogacy law. Surrogacy usually means a class of rules, regulations, and laws that states use that give the power of decision making to an immediate family member, next of kin, or children if there is no decision maker. So let's say that Mary Smith is 80 years old and has pneumonia and has gone into a coma for 10 days. She doesn't have an advance directive and she doesn't have a power of attorney. Maybe she doesn't even have a DNR. Under surrogacy rules laws, the hospital would probably talk to the closest family member. Now, surrogacy laws are really helpful when healthcare providers don't know what to do. But they're really unworkable if family members, next of kin, or children are contentious with one another. So if the brother of Mary says, do this, but the child of Mary says, do this, often medical providers are hesitant to follow the surrogacy law and just pick one family member. They would rather fall on an advance directive or a power of attorney. Now, guardianship is really complex. I've included a video in this week's materials that's about 10-15 minutes long if you're interested in hearing more about how guardianship works. Guardianship is really different from all the other categories we talked about because this is a court process. When you ask for guardianship from a probate court, you're saying, I want a judge to give me all the decision-making power over this individual. A judge can decide whether or not to appoint a guardian that will make decisions. The extent of the decision-making is usually going to be described by the court decision. So some courts can say, I give Mary's daughter all the decision-making power about her health care. Or they could say, I give Mary's daughter this very limited power in terms of healthcare decisions. However, guardianship is not written on a document by you and your doctor or you and your lawyer. It is basically done by a judge and can only really be undone by a judge. So if you want to undo a guardianship, everyone really has to go back to court. So here are the caveats. So with guardianship, that's a court process where the judge gives decision-making to another person. But with all those other examples we gave, Mary, the patient, still holds the power. So if Mary wrote an advance directive or a DNR or maybe a power of attorney, but later said, you know what, I don't want this, I want to change it, I want to do something different, she's always allowed to do that. Guardianships, that cannot be undone. Now, one of the reasons this is important is because sometimes a guardianship is needed if a person can't make decisions or go back and forth between decisions. If that sounds confusing, it's because it is confusing. I would suggest watching the guardianship video. There's actually a couple more in the series, and you can watch those if you want to learn more about it. Or please post a question that I can answer in your forum. So, as I said, usually everything but a guardianship can be revoked at any time by the patient. Another caveat that I briefly mentioned was that states can all have different aspects of these rules. So what I'm giving you here is kind of a general way how this process works. Maine, Massachusetts, and New Hampshire can all treat these very differently. just like California, Washington, and Arizona could treat them all differently. So nothing said in this week's slides is across the board a fact. So that's it for week 8. Really go through the materials before you get into the ethical assignment. It'll really help clear up that assignment and the expectations. As always, I'm here for your questions, comments, or concerns. Have a great week 8. Thanks.